few faces are familiar, but few faces are very new. Anyways, we'll introduce ourselves a little later. Let me introduce myself first. I am Raji Raj, Program Head of Anunitha. I take care of the admission, discharges, families, the campus altogether. Few might have seen me, but few, of course, for me also it's a new face. However, said all of this, I think this is our 12th or 15th family support group that we are organizing. To brief you a little bit, this family support group is something that it's happening every month, mainly focusing on family to handle emotions and handle their own emotions to handle the recovery or their ward. Okay, here we will learn not to kind of bring in change in your ward. They lapse, they relapse, they go through multiple emotional issues, but that's not the major focus. Yes, of course, understanding them is important, but here we focus more on how to manage ourselves, how to manage our emotion in handling them. Okay, so I request everybody to focus on that aspect rather than, what's happening with my ward. Why is relapse happening? Why is like that? Or is it my mistake? How should I change? Nothing. Let's sit here with an empty mind, listen to what the presenters talk about. Yes, of course, we have a lot of queries about it. We are here to discuss towards the end of it, all right? But there are three sessions that we have trying to look at it. One is about the topic, then there's a role play, and a case discussion at the end of it. So we'll get a little more in depth of, with role play and case detailing, we'll get to, understand and learn, right? So welcoming Ms. Saujanya, Arushi and Shravan. They are the presenters here. Handing over the mic to Saujanya.
Good afternoon, everyone. Yeah, so Raji ma'am has introduced me, and few of you knows me, I think. Yeah. So why we are conducting family support group? Yeah, she's already explained. Okay. And today's session, enabling and supporting behavior. Okay. Why you choose this topic? Because like a few of our treating team therapists are shared that most of the families are very good giving in the enabling behavior but lacking in the supporting behavior. So we thought that we will just discuss in this session that a little more we can also give you the little bit points that it will help you to manage your client better. Okay, so yeah, so in today's session we are discussing about what is enabling behavior, what is supporting behavior, and also in the enabling behavior how it's affecting to the addiction. Okay, addiction recovery time, as well as example for that. Okay, so these things today we are going to discuss. So the first, what is enabling behavior, Shravan will take care. Okay, so I request Shravan to take over the session.
Hi, good afternoon all. So I am so delighted to stand in front of you in this occasion. So today our topic is enabling versus supporting in addiction. So these will be the key points discussing in this session, like understanding the difference, common forms of difference between enabling and supporting, common forms of enabling, impact of enabling in addiction recovery, what healthy support looks like, communication techniques, tools to transition from enabling to supporting. So these are the key points which we are going to address in this session. So before coming to that, this mental health, de-addiction, all these aspects, still people are, very confused about the treatment and what is going on with the client. People are very confused. And there are a lot of myths and misconceptions in this particular area, which need to be psycho-educated in a very proper way, so that they can, manage the clients in the family itself to some extent. Of course, therapy and medicine it is required, but still, as a family member, we need to be aware what the person is going through. We need to be aware about their problems for helping them. So coming to the topic, enabling. So what is enabling? What is your understanding? Of course, in the screen, the definition is there. So it is nothing but helping someone avoid the consequences of their addiction or a problem. So helping someone avoid the consequences of their problem or addiction. So I'll tell you an example. Nowadays, everywhere, every family we can see a common form of enabling behavior. I will tell you. So when a baby child, when he cries, okay, nowadays we are seeing this. When he cries, to stop the crying, what their parents does? They will just give their mobile phone. It is very common nowadays, right? So by doing this, they are just enabling that behavior. That conditioning is happening. Gradually the child, okay, himself, he will start thinking that, if he want mobile phone, he just need to cry. Knowingly or unknowingly, the family is encouraging that particular behavior. Just an example, I am saying. Okay. Common examples: covering up mistakes, making excuses, financial support without accountability. More definitions I will tell you in next slide. Yeah. So here are signs of enabling and why it's harmful. So these are the common signs of enabling. Denial or minimization of addiction. It is nothing but some people think that, okay, one drink, one glass of alcohol is fine. That is not a problem. He is not, he is not drinking 5 to 6 glass, or, that binge drinking is not there. Just one drink is fine. Why? Because he will be stressed. He will be very stressed. If he drink one glass, his stress will be, gone, and he can work properly. He can go to his workplace. Like that, but it is a problem. They are just minimizing. They are just viewing it as, something which is not that problematic. Again, it is leading to a new term. There is something called self-medication hypothesis. Have you ever heard about this? Self-medication hypothesis. It is nothing but, there are many people, whenever they get anxious, whenever they get restless, okay, whenever they get angry, whenever they are not getting sleep, okay, to address these problems, they will start taking substances. They will use this substance as a medication for this problem, to solve this problem. Again, by enabling this behavior, we are encouraging these kind of new problems. Fear of confrontation, yes. This is especially seen between spouse, like marital relationship. Yeah, it is visible in, this child and mother relationship also. Yeah, parental-child relationship also. Yes, it is there. Fear of confrontation. It is nothing but, if we block that particular activity, if we say no to him, what he will think? What if he get angry? Okay. What if we start a new conflict? They just want to avoid this. That is a fear of confrontation. So that addiction problem or that existing problem, which will be not addressed in a proper way because of fear of confrontation. That is one sign of enabling. And the other one, guilt-driven behavior. Some people, very sensitive, they will think that, I owe them something. Okay. He is doing this, he is into addiction because of my problem. I am the reason behind this. There are some people, it happens because of low self-esteem. Okay. They doubt themselves. They think that they are the problem. They are the cause of, why their son or their spouse is going through this particular situation. Guilt-driven behavior. And there is something called codependency. You know what is codependency? So codependency is nothing but when a person, he gives more attention to the needs and problems of other people, okay, while not addressing their own needs. It is what codependency means. This is also very common in addiction. Very common. Because they just don't want to say no to whatever demands. They are just afraid. They just don't know how to be assertive. Constant rescuing or bailing out. So what does it mean? Constant rescuing or bailing out. Okay, I will take addiction as an example. Suppose a person is into gambling. Okay, he borrowed a lot of money from other person. And after some day, after some week, that person will come for asking money. Okay, and he won't be able to, pay it back because he will be already in debt. Gambling guy. So what does the parents do? They will just finish it off. They will just give the money and they will just close the topic. And while coming to alcohol addiction, there are some people, because of their alcohol addiction, this drinking habit, they won't be able to do their work properly. They won't be able to go for their job in a daily basis. And the number of absentees increases gradually. And some families, they will, what they do is, they will just contact with their managers and they'll tell some excuses that he is going through some problem like, some disease or some other problem, and they will just close it like that. These are the common signs of enabling. And why it is harmful. Now itself, I am pretty sure that you know why it is harmful. It blocks accountability. What is accountability? Sorry? Ownership. Accountability is nothing but, responsibility of a person to their own actions. For a gambling guy, if we are giving money, family, we are giving money, okay, we are just resolving that problem. And he won't be able to know the underlying problems, like how to solve that problem. We are just blocking that accountability. Then he won't be able to, take responsibilities in coming situations in the future. Encourage dependency, of course. By this enabling behavior, we are encouraging dependency in two ways. One, already that person is relying on family members because whatever she does, no problem. Family will resolve it. Rely on family members. And they keeps on doing. They'll be dependent on that particular action they have been doing. Reinforces harmful actions. Yes, of course. They keeps on continuing doing that. And reduced motivation for change, of course. Why it happens? Reduced motivation for change. Because they know that I have supporters. If something happens, I have a back support. They will help me. They will just solve it. I don't need to worry about it. I don't need to change. Whatever things I am doing is okay. So they don't know, they are not aware about that, that particular problem. They won't view it as a problem. Because family members are always enabling his particular habits. Of course, delayed entry into treatment. I don't think you need explanation for that point. So, I already explained the signs of enabling and why it's harmful with some sort of examples. So, I am welcoming Ms. Arushi to explain the next slide.
Hi, hello, everyone. How are you doing? I see the energy very dosed down. No smiles, no reactions. Okay, better now. Okay, so now that you know what is enabling, what do you think would be the supporting behavior? How can you support this, your word? Any ideas, anything, any response, even if it's one word? Nothing? Okay, all right. So I'll ask the question again, but after explaining, okay? So when we say supporting, we use this word quite often. Like we are supporting our child, we are supporting our husband, we are supporting our parents, we are supporting our relatives, something. But what exactly support means? So support is an act of kindness done to show our care, our love for our loved ones. It is offering our care and encouragement and with patience, but also keeping the accountability intact. Okay, so supporting is geared towards the positive change. It always brings a positive change. So we can see it from this example that supposedly if someone has, they have a fracture in the leg, how will you support that person? You will help him walk around holding his hands, right? So how can you, so basically what you're doing here is you are not walking for them, but you are helping them walk, right? This is what supporting means. And it is very essential in addiction recovery. Supporting is providing emotional, practical, and moral support. How can you provide that emotional support? By the words of encouragement. For example, you can say, I love you, and I am very proud of you for maintaining sobriety. Even when we know that it is hard, we appreciate you, we are proud of you, or whatever progress you have made. Practical support, we can practically support the ward by setting realistic help. What is realistic help? We do not force or push them or take the decisions for them, but we show this realistic help by, for example, saying that, okay, you have a doctor's appointment, you have a therapist appointment, so do you want a ride? Do you want us to come along with you? This is what? This is what? Practical support, yes. Then comes moral support. So moral support is giving the reminders to the ward, towards the loved one, of their strengths, of their capabilities. That, you took the decision of taking or seeking the treatment, you have determination, you have willingness in you. So just reminders once in a while is healthy. That is how you can support, or you might already be doing that thing. Okay? Then encouraging healthy choices and treatment. So when it comes to healthy choices and treatment, we can say that, attending the AA meetings, attending NA meetings, and when they have said yes for seeking the treatment, or when you were, at home also, when you were trying to convince them that seeking treatment is an option and they agree for it, or you're setting boundaries with them. This is how you can support them with making the healthy choices. Plus treatment, apart from attending the support groups, can also be like, taking the therapies, and also taking the therapy for your own self, attending the support groups for your own self. So you can also model this behavior that seeking help is not a sign of weakness. It's a strength. Okay? Then creating a safe and structured environment. So when we talk about safe and structured environment, we mean that the family environment, the home environment should be calm and stable enough that promotes the recovery. Okay, it should be less chaotic, it should be less stressful, and that promotes the recovery. So and you can model the healthy coping mechanism here by, for example, if there is some argument happening, and there is yelling and shouting which used to happen before. How it can be here is like, you can tell them politely that I am upset right now. I will talk to you about this later on when I'm calmed down. So all of these healthy models we can follow. What are the examples of healthy support? Attending family therapy. Many of you might know what is family therapy, but for those who don't, family therapy is essentially a therapy session in which both the client as well as the family is the part of. So how it helps is, okay, when the client is, going through that addiction phase, and the families have given them numerous chances, there is a communication barrier, there comes a breakage of trust, there are certain expectations which are set. So family therapy will essentially help in both the people sitting together, coming together and talking about it in a healthy manner without putting, blaming, without putting the blame on each other. Because of this, I started doing the drugs, and the family will say, you started doing the drugs or you started drinking because of this reason. So the child can say, for example, that my childhood was difficult. That's why I started going towards the substances. So these all issues will be navigated in the family therapy. So it will help build in the communication, rebuild the broken trust. It will set realistic expectations between the family. Okay? Sometimes the family will be like, will have this expectation that my child should, or my loved one should listen to me completely. They should allow me to monitor them. They should allow me to be aware about everything, about their personal life, who they are meeting, and all of those. But that's not realistic. They also need their privacy. And this is what family therapy will tell you, how you can do it in a healthy way. Okay? Then setting healthy boundaries. So when we are talking about boundaries, we are essentially saying that we need to be assertive. Okay? Healthy boundaries means saying no, but in a healthy manner. Like, no is a no. The ward might ask for another drink. The ward may ask for another, may ask to meet their old friends. So you have to be firm and assertive there that no is a no. You have to set those boundaries. Okay? Then comes encouraging participation in support groups. Like, this is a family support group. Similarly, we have Alcoholics Anonymous, which is AA. We have Narcotics Anonymous. Then we have Gambling Anonymous. So for different substances, we have these support groups available. We also have sponsors available. Plus, there are multiple national helplines that you can Google and you can reach out to. So these helplines, these support groups, they will give you the tools. They will provide you the tools of how to cope up with your ward's behavior, as well as you can also seek help from it for your own mental health. Okay. So this is how support group will be beneficial for all. Then comes celebrating sober milestone. Again, this is very important, and this is one thing which most of us just forgets. If the person is maintaining sobriety, even if it's a 3-day sobriety, that needs to be celebrated, that needs to be applauded, that needs to be praised. Okay? How it will work is that the ward, that the loved one will feel appreciated, will feel more motivated, that, okay, my doing this thing is, bringing this feeling out of my parents or my wife or my family member. So he will continue with that recovery. He will feel motivated. He will feel encouraged. So celebrating these sober milestones, it's quite essential. It's quite crucial. Now I'll hand over the next slide to Ms. Saujanya.
Okay, so I hope you got the clarity that what is enabling behavior and what is supporting behavior, right? I want this session like a little more interactive. Any examples or any situations you want to say it here, explain here? Any incidents like you had when you are dealing with your ward? Okay, so see, we are not saying that enabling behavior only the problem. Okay, so of course, if in some situations for children and all, for just motivate them, so enabling behavior is fine. But when it comes to the addiction recovery, it's the problem. Okay, that's what we are trying to say. And we are not saying that enabling behavior only is the problem. Okay, so I hope you understood about that. Yeah. So now already Arshi and Shravani explained about the supporting and enabling behavior. This is just the differences both of the enabling and supporting behavior. So already they gave the examples also. See, in the enabling behavior, you can see the avoid consequences. Okay, so they don't want to face the consequence. Instead of facing the consequences, they will avoid that situation only. The example, okay, son or the family member, anyone, asking money for drinking, okay. So you know that he is asking money for drinking only, but you are giving him the money. Why? Because otherwise he will create issue at home. He will be aggressive. He will show his tantrum. Okay, for that reason at least you will give. So this is called avoid consequences. Okay, so feeds the addiction, same. Okay, I don't want to again repeat the same thing. Feeds the addiction means we all know that they're asking money for that. They're using, example, he want to go out and you are saying no, okay? But you are aware that he is going out for like smoking cigarette only. But still, we can't stop that, okay? So you just encourage that and you'll just leave them to go, okay? So money also same, okay? It's called like feeds addiction, okay? And the driven by fear and guilt. Okay, so already Shravan has explained that, but still I'll give one small example. So the person is staying in like rented house or PG outside. Okay, you already gave him the money to pay the rent. Okay, but he used that money for his substance. Okay, so you will be having fear or the guilt. If I am not giving money, the person will send him outside, and he have to face that situation. Okay, you also will be having guilt that like something wrong from my side only. That's the reason I am not able to like manage him. Okay, keeping that in your head and you will just go forward with that. Okay, so short-term comfort. In enabling behavior, what happens? So for that short-term comfort, okay, you don't want to like mess the situation. You want to keep them calm and like relaxed. For that short-term comfort, you'll just approach their things, okay? If they're asking for money for addiction also, you won't say for anything for that. Because if you're doing that, your mental peace will be affected because of that, okay? So in the same thing, in supporting, like allows accountability, already he told about that, he has to own his own responsibility, okay? If he's doing something wrong because of his addiction or anything, he has to responsible for that. For covering up that things, we should not do anything. Okay, so encourage the recovery. So as Arushi told that, we can support them for the recovery. Okay, we can only walk with them. Okay, the walking they have to do, right? The same thing. So driven by the love and respect. You have love and respect on them, but you no need to show in that way that you are supporting his addiction. Okay. And the long-term growth. So when you're like focusing more supporting behavior, of course, the growth will be the long-term. Okay, not for that short-term like satisfaction you're doing something. So you're doing like supporting behavior for long-term growth. Okay, so the next we are showing one role play. Okay, related to the enabling and the supporting behavior. Okay, the first we are showing the enabling behavior. Okay, after that, we will ask you also, like, do you have any, like, things to discuss about that? Okay, after that, we'll show the supporting.
Supporting behavior, it's not a one-time solution. It's a gradual process again. Probably you have to multiple trial and errors with the same instance to check whether the child is coping with that, okay? So when we say supporting, imagine that, to enable a person, it took 5 years, okay? I won't say the same year is required to support the patient, but there's a gradual and slow process that happens through it. We don't have a one-time solution to it. It all depends upon the child's personality as well, that what has led to that situation, all right? Whether the child is into a situation that he has got into an aggressive state or a rebellious state. And if it's a rebellious state, the attention should be to how to solve down or settle down the personality or the aggressive factor to it. So that should be the focus first. And then eventually it's taper it and get it to a state of it. So for us to tell you a correct solution, probably required to have a full scenario of a full story of it. But then as we are talking about the supporting system, you cannot, nobody can get into a supportive factor at one stretch or at one time. It's a gradual and a slow process. We'll probably discuss the case in little later and then we'll come to that. Yeah.
Hi, Aman. What happened? You look tensed. Are you okay?
My boss called me and I have to go to my office tomorrow.
Uh-huh.
Yeah, I think I need a drink, a small drink.
No, Aman. You promised me that the last time you are drinking, that is your last drink. You promised.
I'm only asking for one drink. What's the big deal? What, you want me to go to office like this? You want me to show my face like this?
Okay. Please calm down. Please don't be angry. I will agree for one drink, but this will be your last. You promise?
Yeah.
Are you sure you promise?
Yeah, I promise.
Okay,
This will
I'll
be the
get you
last.
the drink.
What is this behavior? Supporting or enabling? Enabling. So instead of she's giving the drinks, what she would have like tried?
The respect, for especially men, ego is a major factor. Wife cannot tell his husband not to go to work when he is in a state of withdrawal. What you're seeing is a state of withdrawal here. That he is, even though, going to office or something is triggering him, and this triggering has led to a state of craving. So what he feels and what he has got into a situation that over the years he has got into a state where I can manage with one peg, but he's not accepting the fact that that one peg is not going to serve his purpose, right? So it's all just he's trying to convince his wife that one peg is enough for me to solve the whole issue. So what is wife here? What's the wife's personality here? She's convinced with her husband's words. What is her intention? That I want my husband to be all right. Right? It's a good intention. But then she fails to understand that she's trying to enable his behavior. Right or wrong? Right. So instead, what is that we are trying to learn it here is, instead of enabling, how to support it. Right? So I think we are going to demonstrate that here.
So he got a little anxious and he asked for another drink, which I agreed for.
Okay. Do you feel that it's correct? Because that's what he was doing since very long.
It's not correct. I know it's not correct, but he started getting angry and aggressive, and I've seen this happening multiple times before. And he always says that, the last drink, like this time he's drinking, that is his last drink.
Okay. So I think he has to take some help as well as you.
Yes, definitely. Yes.
Okay.
Hi, Aman. What happened to you? Are you okay? You look tensed.
Yeah, my boss called me and I have to go to my office tomorrow. I think I want one more drink.
No, Aman, we talked about it last time. I'm not allowing one more drink.
I'm asking for one drink, one small drink. What's the big deal?
No.
Like you want me to show up like this?
No.
Do you want me to go to office like this?
No means no. Listen, I can't do this anymore. It's affecting my life. Your drinking habit is affecting my life. I am being affected emotionally, physically. I don't have my mental peace anymore. I can't. It's affecting my work as well. And today morning we received your blood test reports as well. Your LFT values are deranged. So it's high time we seek help now. Can we do that?
I don't want to do anything. I just want a drink. I will go to office tomorrow.
I can't continue living like this. We have to do something about this. It's a huge problem now. It's affecting me, it's affecting you.
Okay.
Okay, you agree for the treatment?
Yeah,
Okay,
I will come.
okay.
So as Rajima mentioned, in the 1 or 2 attempt, they won't agree for that. So, okay, when it happens continuously, so we have to keep convincing them and ask for the treatment, take the help. Okay, so after a week of detoxification, Aman got chance to talk to his wife. Okay, so you can see that scenario now.
Hi.
Hi, Dia.
Hi, how are you? You look better.
Yeah, I'm good. I'm feeling that energy. I think I'm done with the treatment. Yeah.
Okay. Okay. See, I understand that you saying yes for the treatment and taking the treatment was a brave step. I appreciate you. I appreciate the effort. And I see your efforts. It was quite hard, but you did it. So how about, what I suggest is we talk to the treating team first and then we see how it goes.
Yeah.
Okay? I believe in your capabilities. I believe in you. You can recover from this addiction. Okay? You
Yes, I
have the
can.
strength.
Yep.
Okay.
Yeah. So the last part why I have shown, because like still the wards are taking treatment inside the rehabilitation. Okay, after a week or 2 weeks, they will start saying that we are done with our treatment. It's high time to take discharge. So before taking like decision, it's better to talk to the treating team and decide. Okay, the same thing like OP consultations you will go. Okay, and doctor will suggest the medications. So after a week or 2 weeks, they will feel fine and good. Okay, so without taking consultation, they'll stop taking medicine. So it's better to avoid those kind of situation. Always like take the professionals' help and stop it. Okay, so we are moving to the next slide. Okay, I'm handing over the mic to Shravan.
Enabling and supporting behavior, which is just for your understanding, we have done it, but doesn't mean that it's so easy is the ways you see here, all right? It's, it required multiple attempts, but what's the learning here is that here, for a patient or a person who is into an intoxicated state or a dependent state, he or she gets into a pattern of behavior itself, not only drinking. Drinking is one pattern, and there's a behavioral pattern as well, which is developed over the years. Could you see that pattern here? Right? What is a pattern? That getting aggressive with wife for getting his demand done. So the person who is intoxicated gets dominant and gets his demand done by threatening wife or shouting, screaming at her. She's been conscious, she's been worried about the society, people around. She tends to make silence there. Correct? So the threatening, it's not the only intoxicated behavior, it's a way of threatening and getting the demands done. That is also a pattern, right? So the moment the spouse or the parent becomes strong, it's okay. Today let him damage things, let him create records, let him do this, okay? Take a chance to try and see that. 100% I can guarantee you that you will find a difference. But are we dare enough to do that? Or we are more worried about the society than the pattern of drinking here? Yeah, it's always a question, right? So this is one way to get into breaking that behavior. We required multiple attempts, multiple trial and errors, but I'm saying consider this as a threatening behavior, not anything else, not that he's too much into it. He's trying to take advantage of the emotions here. Okay, so that is something that you also required to understand from the role play that's, played here. Okay? Right.
So I hope the right message was conveyed and you understood the topic, and now you are able to differentiate both enabling and supporting through that role play. So, yeah, I am back to counselor, back from character. So, so I'll be explaining how to stop enabling. So I know that, afternoon, I know it's after 3 o'clock, you had lunch, you'll be very sleepy. In our campus also, third sessions will be like that. Most of the time, when we go for sessions, they'll be like. Anyway, so how to stop enabling? The first point, learn about the ward's problem. So who is the ward here? The patient, the person who is going through the problem. So just learn about the ward's problem. For that, just talk to him. Just try to listen what he wants to say. Just communicate with them. For that, we need a proper communication skill. Just try to understand the problem. Then only we can seek for treatment. Right? And differentiating necessity versus demanding behaviors. So what is necessity and demand? We need to be, able to differentiate what is necessity and what is demanding. Right? Because in our campus, in Anunitha, like, I have been seeing many family, after giving a single phone call, okay, they will just keep on threatening, like, I want my phone today, otherwise I won't stay here. Who are you to decide? This kind of threatenings they will do, and family will agree, okay, give 1 hour, 2 hour phone. It is not like that. What is a necessity? Like providing food, medicines, that is something necessary. But don't encourage unwanted demands. We should be able to differentiate. Let natural consequences occur. Yes. In the beginning, I told an example of a gambling guy. He borrowed the money. Let him pay. Let him know the impact of his actions. We don't need to support. We don't need to enable by encouraging his, that particular behavior. Avoid blame or shame. Yes. Instead of criticizing him, just make him understand these are all the problems which need to be solved. Just make him understand politely. Just talk to him. Because again, criticizing, being angry with them, it may create some other issues. Of course, that person is already going through some problem. First, we need to be able to, manage our own anger. I will tell you a story. Are you ready to listen? Okay. I will tell you a story. So all the story starts from once upon a time. So once upon a time, there was a monk, sannyasi, Baba. Okay. So one day, an 18-year-old boy, he just approached. He went to this Baba and he asked, like, Baba, I am very angry, basically. My relationship with others are getting strained day by day. Baba, how to control my anger? What can I do? Can you please help me? Okay. And Baba said, yeah. Whenever you are getting angry, you just take a wooden furniture, take a hammer, and put nails. Whenever you are getting angry, many days passed. He started following Baba's advice. Whenever he get angry, he started putting nails on that furniture. Weeks passed, months passed. He kept on doing that. So after some time, he came back to Baba. Baba, so it's been many months. I have been doing this, whatever things you told. I have been putting nails in that furniture. And Baba said, okay, now you remove those nails. And he started removing those nails. And what was the result? Marks of the nails in that furniture. So our each and every words, it is like that nails. We should be very careful. We should be under control, like our temper, our anger, because it will hit here, those nails, our words. So just politely talk them and make them understand what are their problems and make them understand why treatment is required. I'm inviting Arushi.
Moving further, we'll discuss about the role of family in recovery. We have already discussed a lot of points about what is support, what is enabling, how we can, we have little bit of tools, how we can navigate through the enabling behavior now. What furthermore is our responsibility as a family member, as a caregiver? First being an emotional anchor. So emotional anchor means a person who is steady and secure enough, who can act as a support system, a stable support system for the loved one. As in, do you know there is a ship and there is an anchor? So the ship stops when they drop down the anchor, and it becomes quite stable in the heavy waves of the sea. So this is how the family members have to be for their loved ones, for their wards. They need to be this reliable enough. The ward needs to have this much trust upon them. They need to build that relationship to this level that the person, that the ward feels comfortable enough to come and approach them whenever they feel like. be it 2 a.m. in the night, or it's 1 p.m. in the afternoon when it's busy. So this is how we strive to be as a family. Okay? So for example, how you can be an emotional anchor is, again, through the words of encouragement, for actually showing up for your word, for actually showing up for your close one. If they are calling you at you'll say 2 a.m. and they are saying they are feeling the craving, or they are feeling triggered. So you make sure that you have some resources which can be provided to them. You either talk to them over the call, or you physically be present with them. You are there in some way. Okay? Then education and understanding. By education, we means that we see addiction as a disease and not as a weakness. Addiction is never a weakness, it's a disease. We as family should be responsible to learn about our child's addiction. What will the recovery process look like? What will the withdrawal symptoms will look like? And when a person becomes addicted, there are several brain changes that happens. There are certain body changes and brain changes that happen. So how it is a maintaining factor in their addiction. We should be aware of all these things so we can be a better help to our loved one. It is, as a family member or as a third person, it is very easy to say that, oh, it's just drinking. Why can't they just stop drinking? Okay, it's a simple task. No, it's not that simple. There's a whole system of brain and dopamine and neurotransmitters which gets involved. So by educating yourself, you will be a better help to your ward. Plus, you will also have the tool skills. You will understand, okay, the mood swings are there, and there is also something called post-acute withdrawal. So once a person is in that detox phase, they will be very moody. And when they are very moody, they might say very harsh things to you. They can be very aggressive. They can say very hurtful, harsh things to you. So you, as a family member, has to make sure that you don't take these things personally. It's just a part of their healing. Okay? Then supporting autonomy and accountability. So autonomy and accountability means that you let your loved one suffer or face the consequences of their own recovery journey, of their own actions or decisions. Okay. For example, your son or daughter has to go to the college. They are skipping the college and they are doing the substances, or some or the other excuses they are making. Then you get a call from their college or school that they will not be allowed to sit for the exams and they have to repeat a year. You let them do that. Until and unless they don't face the consequences of their own actions, they will never learn. They will never realize their mistakes. So I understand it's a very difficult decision to take because you care too much for them. You don't want their time to waste in this situation. But you have to be this strong. You have to be this resilient for them. Okay? Then role models of healthy coping. Again, we expect the ward to, maneuver through their recovery process, to handle his own recovery process by them. We have given you the treatment. We have done what was in our hands. We have done everything in our power. Now its rest is up to you. What else you can do is you can model those healthy coping mechanism. For example, if conflict is happening at house, you are feeling dysregulated, emotional dysregulation is there, or because of your work you are feeling stressed. And if you are going home and you are taking that stress out on the resident or the ward, he will learn the same thing. He or she will learn the same thing, that it's okay to model this behavior, to copy this behavior in my own self. So next time, even I am feeling stressed, I will do the same with my parents, I will do the same with my family members. So you have the ability of minimizing this effect, of changing their coping mechanism into a healthy way. Then important part of relapse prevention. So preventing the relapse is also a power which you also hold in your hand, preventing their relapse. Okay? How? You can start noticing when there is a, different behavior is coming in. For example, isolation, or they have started skipping meals, they have started skipping their classes, they have started skipping their work. So you will notice. You have to be mindful and you have to notice all these things. And you can pinpoint then and there that, what is happening, but politely. You don't have to push them, you don't have to force them. That's what supporting is. You don't have to walk for them, you have to walk with them. Okay, apart from that, you can model healthy behaviors again by being the part of support groups where, you are seeking therapy for yourself, you are seeking help for yourself, and you are also changing your own coping styles, your own coping mechanism. Earlier, whenever you used to feel angry, you used to lash out, or you used to indulge in emotional eating, or, you used to shop a lot. These are unhealthy coping mechanisms. What different you can do now is, you can tell them that right now we are upset, we are angry, we'll talk to you later. Or you can, divert or distract your mind with practicing meditation or, mindfulness. So all of these are healthy coping mechanisms which you can follow. So now, do you have a little bit of idea about enabling and supporting behavior? How to differentiate it, what you used to do before, and how you can, be different this time? Yeah? Little bit difference in the responses now? Okay, I'll hand over the mic now to Ms. Ajanya.
So this is we'll just go through fast, okay? So this is the communication techniques we can see in the enabling and supporting behavior. Okay, we already had so many examples about that, and scenarios, everything we explained. Okay, just see that the enabling behavior, you can see that minimizing, like not saying too much about the problem. It's okay, one drink, no. It's fine, he's having stress, that's the reason he's drinking, in that way. And speaking for them. Okay, it's kind of covering up the problems and ignoring the red flags. You are aware that his lapse or relapse is happening, otherwise he's intoxicated, but still just ignoring that red flags. Okay, and avoiding confrontation, because if we're doing that, it will be a problem and we have to face that situation. Okay, and also taking the blame. So because of his mistake or something, you are ready to take the blame. Okay, those kind of things we can see in the enabling behavior. And supporting, we can see that using I statements in the role play, how Arushi said that I am affecting because of your drinking, I am facing a lot of problem. Okay, so keeping the I statements when you're talking with them. Okay, and setting boundaries, active listening. Just talk to them and listen what they're going through, understanding their problem, okay? And naming the behavior. So whatever you are observing them, just tell them, this is what you are doing, okay? You were aggressive yesterday, you broke the thing yesterday. So you have to tell them that directly, okay? So allowing the natural consequences. Already in the first slide we explained, let them face the consequences, okay? So encouraging the treatment or help. Okay, and practicing the self-care communication. That also we already explained that you are like learning how to talk to them, and you are taking also some support from the treatment team. Otherwise, they're like therapy sessions and all. Okay, so please come.
Ways to support positively. So I like to do an applause. Claps for yourself. Claps for yourself. You are the real warriors. Because you are already here. It means you are already supporting them. You are spending your precious moment, your precious time for this, for the recovery of your ward. I really appreciate that. Yeah.
Asking, appreciate yourself. Clap for yourself.
Clap for yourself.
So how much strong it should be.
Yeah.
This much you are doing, but you are not able to appreciate your pat on your shoulder for what you are doing. So let me hear once again, please. Oh my. Thank you. That's nice.
Thank you. So, open and honest communication. maintain consistency and boundaries, offer encouragement without pressure, and be involved in recovery plans and therapy. So most of the points I already explained. And the last point, be involved in recovery plans and therapy. You're already doing, you're trying your best. Keep going and continue in this, this way. Thank you.
This is the one case we mentioned here. Okay, one boy, it's circle, no? Yeah, kindly please sit in the circle. So it will be just discussion and together question and answer. So with the friend. So he comes home upset and asks his mother for money. Okay, so saying he needs to calm down. His mother knows he might use the money to buy alcohol. So she is worried if she refuses, he might get angry or leave the house. Okay, so this is the discussion points. Like if the mother gives him the money, is it enabling or supporting and why? If mother says no and encouraged him to talk to his counselor or attending a meeting, is that supporting? Okay, so at least you're understanding, right, what is difference between enabling and supporting. Okay, what else can the mother do the show support without enabling the addiction?
This is something which I wanted to bind down from the big. See, we are all talking about a state of dependency or addiction, right? But tell me, think about it, that it takes almost 5 to 10 years of work to get in a state of a dependency and addiction, right? So we consider that it is a problem only then, in a dependent state or addicted state. And then we kind of push it out, right? Okay, it's okay, chalega. It's okay, he's not making any damage. It's okay, he's managing control. It's okay, he's not aggressive. So we're trying to convince ourselves. It's because, either we are affordable or our lifestyle is like that, or we have 100 other factors to convince ourselves. So what I'm trying to say is this, that dependency is not with something which has developed overnight. Only you're able to kind of, realize or understand that when it reached to a state that things are going beyond our control. That we are able to reach is where we find this adjustment. Until then, this problem was there. It took almost 5 years, 10 years. So the whole idea of, talking about is that it starts with a state of use. I started using alcohol at the age of 16, 17. But I developed dependency at 25 or 40. So was it okay for us, for the child or anybody to use it? Answer to it, we were in. What were we doing? What was the measure we have taken? How much we could able to how much intervention that we have taken? How much help can we take? This is a question to ask ourselves. Okay? Today we are trying to avoid consequence or avoid the risk factors. But then, this should be an insightful thing that it all started with a news. Over the years, it has come to a state of dependency or addiction. Do you agree?
Well,
Yeah? So, answering to your question, sir, even as I said, we really don't know because it's an unpredictable situation. See, it's all comes with dependent behaviors, right? It can be personality factors like threatening behavior or demanding behavior, destructive behavior, all of that. Okay? It is not even developed over the night. But the thing is, we are scared more than him. Right? We are scared of the consequence. So we try to stop ourselves than stopping him. So we become silent. What we are talking about, to make the scenarios like this, which it will take some time, but it's very hard for only multiple type that is required to get in a recovery state. We know about it. But what I'm trying to say is, today, why the scenario is like this because of between or what to say, as he has rightly said, that unawareness of what does a parent do to their child is only stressed, not hard. But are we doing the right thing?
it's true.
Or is it the right way to deal with situations? Okay, now giving an example, the child is highly intelligent, best in school, hyper, there for every all the activities. For a parent, that's not enough because he's appreciated, he's perfectly fine. But yet, so that is even more vague than his personality demanding offending or any such sensitive issue at home. Very good. Right? Because he's appreciated everywhere. His best in his point is best in all the best possible ways. So this mind, when it starts up in a mind and performance, it's speak low because there are a lot of best things that you do. Okay. So where he kind of what each other go, today, tomorrow. Anyways, he's best. Anyways, he's doing fine. He's okay. That's what we're talking about a nickname. Right? It's because in next home, that silence, that is a permitting. I can't lie. The lifestyle is like this. We have a lot of reasons to kind of, justify ourselves. We are not talking about a dependent state. Dependent state, I'm a check, completely, we are talking about the disease condition. But to get to a disease condition or a dependent state, it took, it will take more than 5 to 10 years, but years later. Right. So now we are working towards, possibility of we get back to normal life. But if there are induced factors or physical or psychiatric factors or mobility where even at the time of discharge, he requires support for this cause. One age is another factor, right? 60 years, same, 65. So 65 is not an age where he cannot live independently. He can live independently, provided that he gain the right insights, is motivated, is determined to take his recovery again. Then he can live independently for another 5 years. But then this not motivated, his insight is not good, is not in a position to live independently, then we have to think about something called supported living. Because we have to take de-addiction is not a place where such function patient can be lifetime with. Right? And I say supported living, it comes with a lot of factors where the person is taken care in holistic way. Where his functionality is respected, he takes care of the business or take care of his job, whatever it is, with the right approach. Medicare and policy, which anyways, we have a supported living disability here that we can talk about it. You are curious about it. Other is, especially for addiction cases, functionality is not a problem. Inside, he is able to gain insight towards the time of discharge. He can live an independent life.
So, good.
But requires continuous care. Alright, check on him on regular treatment basis. Whether he is motivated enough to go back to the clinical keep as being there, motivated enough to take medication, all these parameters also have to be taken into consideration at the time of the switch.